Hi, David Liew, reporting for Room Now for ACI 2020, here from Melbourne, Australia. Zoster is the issue I want to talk about today, and in particular, what to do about vaccination and whether Shingrix might have adverse events on our patients or not. Now, we know that Zoster is a real issue for our patients, especially for those who we immunosuppress. Those are the patients who are greatest risk, and I think we've all had patients who have suffered through Zoster, suffered through postherpetic neuralgia, and really regret it. Now, at the same time, the first vaccine that we had, Zostavax, the Lyme vaccine, was an issue for these patients, at least on paper. And so we've been looking to the recombinant vaccine, to Shingrix, as a solution to that, even when there have been global shortages. But we want to know what to do when we are able to get it. And the question has always come about because of the adjuvant. Now, the adjuvant's there to boost up the response. It's very immunogenic, but that gives you that burden of reactogenicity. And we've been concerned for some time now, for the last few years, as to what would happen to our rheumatic disease patients and their disease when we give them the vaccine. It's always been a big question mark. So Cleveland Clinic and Stéphane Lafont in particular have looked and captured the experience of rheumatic disease patients in their 622 patients who got vaccinated, 359 of whom had inflammatory disease. Variety of different diseases, rheumatoid arthritis, vasculitis, lupus, PMR, and comparing those to the non-inflammatory disease patients. Long and the short of it was that flares certainly did occur in that 12-week period after the dose and after the 2 doses. In fact, about 1 in 6 of those patients did have a flare at some point, but those flares were quite mild, really, quite mild and quite manageable. There were certainly risk factors. Well, there were certainly associations to the patients who were more likely to get it. Steroids at the time of the vaccine conferred a higher risk of flare. But really, all of these were fairly manageable. And I think that really speaks to the idea that even though maybe there's a hazard ratio of 2.4 for flare, but that this isn't something that we should necessarily be scared of, and the payoff is certainly there as well for our patients in terms of Zoster prevention. So I think that's more reassuring data once we get access to the vaccine again, or for those of us who do have access. I think this is going to be the kind of thing which we can really bring to the clinic. For more about vaccinations, infection-related rheumatic disease, and the whole of ACI 2020, head along to rheumnow.com.